We're talking teeth today, and from Simpson Dental, we have Dr. Kristen Simpson. Thanks so much for joining us.
Thanks for having me.
Yes, okay, this is something I know I've noticed in my teeth, and a lot of us have. So why do our teeth shift, and what is the solution for it?
Yes, a lot of people tend to notice some shifting and crowding in their teeth, and they often wonder why it's happening and how they can fix it. So there are some reasons why it's happening. The first thing could be relapse from having braces and not wearing a retainer. So often the lower anterior is where you see that relapse happen first. And that's also because as we age, your teeth tend to shift towards the midline, so you'll get some drifting towards the midline, which also causes some of that crowding. So between those two, either not wearing a retainer and having them recrowd, or that mesial drift, you'll start to see that crowding in the lower front teeth.
Okay. Now, some people grind their teeth, especially at night. Does this also affect the shifting?
It sure can, yes. So when you're grinding your teeth, you're wearing away that enamel, and it can cause the teeth to shift as they're hitting in different places with the changes in your bite. So if you notice yourself clenching, grinding sore muscles, or wearing away of your teeth, you definitely need to get that looked at and have some type of night guard or protection made so that it doesn't continue to get worse.
Okay. Now, what happens when we lose a tooth or have one pulled? Will that change what's going on in our mouth with our teeth?
Yes, it definitely does. So when you lose a tooth, it's like pulling a book out of a bookshelf. Those books are going to collapse on either side, and that's the same thing that happens in your mouth. So not just the ones on either side, but also on the opposite arch will drift into that space. So that'll really start to collapse your bite and affect your overall chewing ability, which can cause joint problems. So it's definitely good to replace teeth if you're going to be losing one.
Okay. What about gum disease and how it affects the mouth?
Right. Well, gum disease is actually very prevalent. It's about 75% of the adult population has some form of gum disease. And as it progresses, you start to lose bone around your teeth, and then your teeth will start to shift. So often with gum disease, you'll see spacing occur as those teeth are shifting and kind of spreading out from the loss of the bone around them.
Okay.
So if you start to see teeth shift or become mobile, it could be that you have gum disease, and a lot of times gum disease doesn't hurt, so you don't even know it's going on. So that's why it's important to see the dentist regularly.
That's what I was thinking. If you get those regular checkups, you'll know, be able to keep up with all of it.
Exactly.
What are some ways that you typically fix this if someone has gum disease?
Well, you can do it with traditional braces, so the bonded silver or ceramic brackets, or clear aligners, which clear aligners are a great option for adults that are thinking about doing it.
Okay. And talk to us about the importance of retention.
So if you are getting your teeth fixed and straightened back up, it's very important that you're retaining that things in place. So you can do it with either the clear aligner, or you can do it with a bonded wire on the inside of those teeth. So like I talked about earlier, the teeth, as soon as you have them straightened, you have to focus on retention pretty much the rest of your life. So you need to make sure you have some type of either a liner or bonded wire. And if you're clenching and grinding, you can use a grinding appliance to also keep your teeth in place. So it would kind of serve as both there.
Yeah, nice to see all these treatment options for us. Thanks so much for sharing this with us, Dr. Simpson.
Sure.